There are certain specialties which are competitive in Australia, and these are the specialties like surgery and anything which has got to do with surgery, like neurosurgery and orthopedic surgery, or upper GI or lower GI, colorectal, plastic surgery, any other specialty which is related to surgery is going to be competitive from not only the training point of view, but also after the specialist comparability assessment finding that top of training job requirement point of view. Now, I get lots of inquiries from students from, or medical students, or young doctors from Pakistan and India and other parts of the world that, look, I'm quite clear in my mind that I want to do surgery, or the other comparative specialties like I want to do radiology, I want to do ops and gynae, I want to do anesthesia. These are all very comparative specialties. If you look at the competition ratio of each of these specialties, and I've done a YouTube video on my channel as well, you get to appreciate how much competition is there. The second part I want to talk about when I've talked about the competition is there is a nature behind this competition. It's not just the fact that you pass the entrance exam, as in Pakistan it's FCPS part 1, and as in India it's NEET PG or some sort of postgraduate entrance exam, or sometimes you can pay yourself in India to get into the postgraduate competitive specialties. In Australia, the entrance exam is either non-existent or is existent, and the criteria of passing this exam is not very tough, but it is actually the how you have built your clinical experience around that particular specialties. How are your references who have well achieved themselves in Australia, in here, in this country? They are speaking about your work, your professional work ethics. So the references have got a scoring point. Your CV in terms of your teaching experience have got a scoring point. Your publication have got a scoring point. So when you apply for these comparative specialty, it's an algorithmic entrance into these comparative specialties. It's not like you do an exam and you walk into it and all you got to do is just be up amongst the top 20 or top 100 of them. It does not work like that. It's reshaping your entire personality. So my advice is you've got to understand how the game works. The game works by you coming to Australia first, gaining your general or full registration, gaining permanent residency, which is a bare minimum essential to get into any training, emergency medicine, ICU, anesthesia, surgery, GP even. You need to be a permanent resident and you need to be in full general after registration. Then you need to have a CV which speaks volume. Whether you want to get into surgery, whether you want to get into obstetrics and gynecology, MS, anesthesia, or radiology, or all of those comparative specialties. I hope it makes sense. I'm not discouraging you. I'm just trying to highlight what the process involves, and I hope it makes sense and you are able to achieve that. Thank you.